Good morning, everyone. My name is Mildred Velez. I am the President and Executive Director of the Fibromyalgia Care Society of America. I come to you today with a brief discussion on how we plan to lead the gender, racial, and social efforts on fibromyalgia care, support, and education. Um, those of you who have been following us for a while will know that a couple of months ago we put out a data report that showed that 94% of the people reaching out to us for care were women. 83% of those women had reported experiencing trauma. Many had reported experiencing multiple trauma. And the top three traumas that they reported was child abuse, domestic violence, and sexual assault. And we are ready, willing, and able to help these women that are coming to us for care. That our waiting list continues to grow. When we put out that data report, we had 351 women 351 people, 351 people reaching out to us for support. And today our waiting list is almost 500. And we have not done any outreach efforts at all. This is just people finding us via social media or finding us via the web and reaching out saying, I've exhausted all my resources. I need help. And we want to help these people. That's why we exist. That's why we started the organization, was to help people living with fibromyalgia. But we do not have the resources to help our community, and that's very disheartening to me for so many reasons. And the most disheartening part of it is that I found in doing this work is that the bigger problem is that the decision makers that decide how these resources get shared are mostly men. So the bigger problem is, the patriarchal structures that currently exist, and it's a bigger problem for us because the community that we are trying to help, there's a lot of miseducation out there on fibromyalgia. And then many of these women, they're reporting these traumas, and most of which happen at the hands of men. But men are the ones that are deciding whether or not we get the money to do the work to help these women. So that's, a much bigger problem and disheartening issue for me. And I'm willing to take that on. I'm ready, willing, and able to take that on as well. But I need your help in other areas in the meantime, because it's going to take some time for me to get some more local women involved on this end that can help me go against that bigger issue, or help me educate educate people more on why there's a need for the services that we provide. But in the meantime, here's how you can help. One is share your story. You can remain anonymous if you want to or not. I respect your confidentiality. We respect your confidentiality as an organization, but it will help me in making the argument that needs to be made about why why our community needs this specialized care. And then number two is connect me with your local house of worship or women's group. Those are two places that usually are, also willing to help support our mission and to support the work that we do, and we need to get more people involved. So if you go to church, please connect me with your local church. If you have a women's group, please connect me with them. Facebook groups are not good because they usually there's usually a gatekeeper that doesn't allow us to share this information there. So that usually doesn't help, which is also unfortunate and something else, but I'm not even going to tackle that issue or speak on that. And then number three is like and share our posts. By liking and sharing our posts, you help us with the algorithm, and you help us get more information out there and educate people on what we are currently seeing, the people that are currently coming to us for care. And then last but not least, I want to also, I don't want to put out any confusing or misleading information out there. So I want to clarify that fibromyalgia is not a woman's issue. It affects children, it affects men, it affects our LGBTQ siblings as well. However, the people that are coming to us in need of care are mostly women from low income communities, and women who once had thriving careers that are now, because of the complexities of fibromyalgia, are struggling financially. That's what we're seeing in our own research. Those are the people that are coming to us for care, and we want to be able to put out that specialized care that's specific to to those community needs. There's other work that we do outside of that specific community, but today I'm speaking to you about that community because that is where we are currently seeing is the greatest need, and is who the demographics of the people that are reaching out to us. And then now, really, last but not least, please allow me to be your voice. If you want me to share anything, or if you need help in other areas, or you have other ideas of how you can get involved, please reach out. I'm here for you. mvelez@fibro.org, or you can contact us through our website, www.fibro.org. Bye for now.